Assalamu alaikum and good day everyone. Today's article is titled Evaluation of Post-Endodontic Pain Reduction Using Intracanal Cryotherapy in Symptomatic Apical Periodontitis. It was published by Australian Endodontic Journal in 2025. Cryotherapy, which is the application of freezing temperatures, reduces tissue metabolism, induces vasoconstriction, and slows nerve conduction velocity, thereby inhibiting pain signals and pro-inflammatory mediators. While it's used as a final intracanal irrigant, shows immense potential for managing endodontic post-operative pain, inconsistencies in protocols such as application duration and temperature highlight the need for further evaluation and standardization. So this study aimed to evaluate whether intracanal cryotherapy effectively reduces post-operative pain in patients diagnosed with symptomatic apical periodontitis compared to irrigation using room temperature saline, ultimately aiming to provide evidence-based recommendations for clinical practice. It is a prospective experimental study conducted from March to August in 2024 at a dental college in Pakistan. They had 88 patients aged between 18 to 60 years presenting with single canal maxillary anterior teeth with necrotic pulse and symptomatic apical periodontitis and severe preoperative pain with visual analog scale score of 7 to 10. Participants were randomly assigned to two groups. Group A, which is the control, received 20 milliliter of room temperature saline as the final irrigant for 5 minutes, and Group B, which is the experimental group, received 20 milliliter of cryo-treated saline at 2.5 degrees Celsius as the final irrigant for 5 minutes. Standard root canal preparation was executed using pro-taper hand files with 5.5% sodium hypochlorite and 17% EDTA as irrigants. Following the group-specific final irrigation protocol, calcium hydroxide was placed as an intracanal medicament and teeth were provisionally sealed. Pain was recorded via the VAS score preoperatively at 24 hours and 48 hours post-treatment, and analgesic consumption was also tracked. Preoperative VAS score showed no statistically significant difference between the groups, establishing a comparable baseline. And at 24 hours post-operatively, the cryo-treated saline group reported significantly lower scores than the controlled group, and at 48 hours post-operatively, the differences between the groups became even more pronounced, with the cryo-treated group experiencing minor residual discomfort compared to the controlled group. Half of the total cohort reported no pain at all by 48 hours. As for the analgesic consumption, cryotherapy effectively eliminated the need for post-operative medications. 0% of the cryotherapy group required ibuprofen compared to 6% in the normal saline control group. So the study's finding align with the previous literature demonstrating that local cooling effectively limits blood flow, reduces the accumulation of inflammatory cells, and deactivates nociceptive pathways. Interestingly, the literature notes that cryotherapy appears highly effective in symptomatic apical periodontitis cases where established periapical inflammation dominates, whereas it shows more limited or short-lived success in cases of irreversible pulpitis without periapical pathosis. The anatomy of single-rooted anterior teeth also facilitates a rapid transmission of cold temperature from the canal to the periapical tissues, potentially yielding better outcome than multi-rooted variations. So in conclusion, intracanal cryotherapy using 2.5 degrees Celsius saline significantly mitigates post-operative pain and decreases analgesic dependence in patients undergoing endodontic therapy for symptomatic apical periodontitis. Given its non-invasive nature, low cost, and minimal side effects, it serves as a highly beneficial adjunct to standard root canal treatments. And thank you so much for listening.